Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Solange Gould and Selma Aly. Welcome to this interview, Solange Gould and Selma Aly. It is an honor and a pleasure to have you with us today.
Thank you so much for having us.
Yeah, thank you so much.
As the co-director of Human Impact Partners, Solange Gould collaborates with government partners, advocates, and organizers in communities and promoted active policy and systemic change to improve health, equity, and sustainability. She has been in public health for over 20 years and works with multiple programs at community clinics, NGOs, and state and local health departments. Selma Aly is a project director of the Bridging Program at Human Impact Partners. Selma has supported, trained, and worked with numerous government agencies and public health departments. The Human Impact Partners is an organization that actively works towards transforming the field of public health to center equity and build a society that centers on health, healing, and belonging. Their major goal is for public health organizations and professionals to actively engage in advocacy and policy changes to advance justice across economic security, community safety, climate justice, and more. As members of a public health organizations, they are involved in addressing issues such as inequitable conditions and outcomes across communities. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us today. Without any further ado, let's begin. This question is for both of you. What motivated both of you to work towards improving public health with a focus on policy, community-based organizations, and health equity?
Sure, I'll start us off. So nice to talk to you today. So I began working in community clinics when I was 19. I was an HIV test counselor, and I was also providing doula services and group education to pregnant people, especially pregnant and parenting teens. And I was also studying to be a midwife. And I spent lots of time with birthing people in clinics, and I saw time and time again that we really couldn't support families to be able to be healthy solely in a healthcare setting, and that it was inadequate. It was important, but it wasn't sufficient for actually supporting health, and that what did support or hinder their health was outside of the clinic or hospital. It was their housing, it was their income, it was their community conditions, their safety, their ability to eat healthy, to feel dignified, valued, free, and seen in society. And so, lo and behold, we didn't know when we were young, most people didn't, there's this field of public health. And I began practicing really popular education, Freirean techniques, and organizing, especially with young people. And that's the sort of technique where you actually work with people to facilitate them understanding the root of the things that are causing them to suffer, and then take action on it together. And so that was organizing, which led me to spaces where young people were asking for climate policies, climate justice policies, housing, jobs, good public transportation, so that they and their families could be healthy. And it really all came together for me because these young people so clearly understood this as being important to their health, but they weren't operating from a public health or healthcare framework or setting. So that really shifted my public health practice to a firm focus on policy change, systems change, and bringing public health into organizing with social justice movements to advance health equity and social justice.
For me, from the beginning, my journey has been fueled by this deep commitment to liberation with my communities. As a Black, non-binary lesbian, from a very young age, I knew the world as it is not as it should be. I started my journey to public health as an organizer, knocking doors, sharing stories, and building relationships with my neighbors in order to build power to win campaigns that change policy. My experience is deeply rooted in local, statewide, and national grassroots organizing efforts, which highlighted how systematic oppression power imbalances, and health outcomes are deeply intertwined. I believe that our greatest power lies at the intersection of grassroots organizing and public health. I am committed to the radical reconnection of the mind, body, and soul, and the collective work of strategic risk, critical discomfort, and transformative healing needed to see the world as we envision come to fruition.
Thank you for sharing. Sounds like a very holistic approach, very centered in the community. Selma, as a project manager with the Bridging Program at Human Impact Partners, can you share some of the projects that your team has undertaken?
Yeah, definitely. So Human Impact Partners, or HIP as we like to call it, is a national nonprofit organization whose mission is to transform the field of public health in order to center equity and build collective power with social justice movements. HIP seeks to bring the power of public health to community organizing groups, campaigns, and movements for a just society. Because of this, we formed the Bridging Program that fosters relationships and builds trust and strategic collaborations between public health organizations and community power building organizations to advance health equity. Our flagship program, Power Building Partnerships for Health, or PPH, supports these collaborations and emphasizes the need for inside-outside strategy as a means to build governing power. Public health departments have long been understaffed and underfunded, and since the start of the COVID-19 pandemic, public health laws and leaders are under attack, and much of the workforce is burnt out. Thus, we can see that governmental public health can lack the political power and capacity to meet the demands of the day, let alone these large isms that we're fighting against. Governmental public health cannot do this alone and cannot achieve its goals alone. We need to be partnering with community power building organizations that have long histories in fighting these fights. We need a strong inside-outside strategy. What we found as a part of our work is that relationships and trust are foundational. In order to address harms, we need a shared understanding and analysis. We need to be building and working together. This is a multi-year process, working to build a deeper and more expansive ecosystem. It's okay to start small. What happens at the small scale replicates on the larger scale. And what small wins keep us engaged and motivated to go after the big wins.
Thank you for sharing. Very challenging work, I can see. Now, this question is for both of you. Can you share about the film production, Powerful Partnerships for Healthy Communities, which was showcased at the American Public Health Association Film Festival 2023 in Atlanta, Georgia? What do you hope to achieve through this film production?
Yeah, I'll start us off. The topic of storytelling is as old as culture itself, and story work is deeply rooted in ancestral and cultural traditions. It is important that we're reminded by, inspired by, and honor the oral storytelling that is cultural practice of Native American traditions, as well as many of our other ancestors. We are all in some way connected and products of multiple storytelling traditions. Knowing this history highlights the importance of storytelling and narrative work as a practice of healing and as an anti-racist and anti-colonialist practice with the power to nurture and reconnect voices and stories within ourselves and our various communities. For me in my public health practice, as well as in organizing, story is an accessible methodology for health equity, for making health equity a verb and an action. This is why I love narrative work, and for its power to be healing, transformative, and truly liberatory. When done strategically and intentionally, narrative can center and grow the power of people most impacted by injustices to advocate for and lead change in our communities. For this project, our objective was to foster a collaborative mindset between government and community organizing partners. We aim to demonstrate the potential of these partnerships in propelling us forward towards our shared goals. Often, there exists a disconnect where each sector fails to recognize the other's contribution towards their respective objectives and collective pursuit of greater influence for substantial change. Our intention was to illustrate these instances where these partnerships have thrived, acknowledging, though, the nuances, pitfalls, challenges, and inevitable hurdles that these partnerships face. By presenting these instances as authentic narratives, we seek to underline the genuine investment and effort required for these victories. We try to frame these as real stories of what it takes to work in true partnerships, emphasizing the specific actions required on the government's part. We want more of these partnerships to flourish, starting with initial interactions, the first date, the first meeting, and progressively advancing towards small victories, and then to more significant collective achievements.
Thank you. Solange, would you like to add anything?
I think Selma really covered everything beautifully. The only thing I would add, Selma covered like a very high level, what is our aspiration? Why did we do this aspirationally? And I would say there's also, there's a tactical piece as well, which is that so many times when we talk to people in government, especially public health professionals and workers inside government, we hear that that's not our lane. We can't support community power building organizations. We don't have the power. We don't have, we're limited politically. We're risk averse. My leader won't let me, etc. All the things we know about how public health can be a very risk averse field. And so we really wanted to show the world that you can create these partnerships, these powerful partnerships between community power building organizations and government equity champions in order to move things forward further and in order to heal some of the harm that has been enacted by government upon communities. And we really want people to see it and keep growing more and more and more, because we need to heal those spaces, especially now as we're seeing a further and further rise of authoritarianism, the desire to destroy our administrative arena of power, which is a very important administrative arena, right? We can wield power from our public health departments and our government in a good way to do good things, but only if we do it in partnership with community and communities that are organizing. So that was also our tactical goal.
Great. Yes, a very important area of conversation, and it's great that you're using film and media as a mean to get the message across. Now, Solange, you are involved in fundraising and managing your organization's annual budget. How do you ensure the excellence and quality of work toward achieving the vision and goals of your organization? And what are some of the organization challenges?
Yeah, well, we do a lot of work with other organizations on their internal culture and on building the container to be able to do health equity and justice work together. And people think of that as a soft skill or as a soft outcome, but it's actually not. It is hard and it is fierce, and it takes a lot of courage. And so one of the ways that we maintain the excellence and the quality of our work at HIP is through our brilliant and fierce staff, and holding a really strong value on relationships. We really center our relationships with each other. And we really work to find staff who are values aligned, who have a shared theory of change around pushing the field of public health to advance health equity, and through supporting relationships and connections and support of social justice movements and campaigns. So we do want people to have values alignment and to all agree on our theory of change. And at the same time, we don't want dogma to set in, and we work to stay open to changing our conceptions, for continued political education to each other, for staying in principled disagreement, for leaning into generative conflict with each other and growing and learning and changing together and saying, you know what, I changed my mind. I actually have a different opinion. I understand this differently now. And so some of the practices we have to support that are shared leadership. We have a leadership team that's made up of staff from various parts and roles in the organization to make big decisions about the organization together. It doesn't just come from the top of our organization. We have a strong set of internal group agreements about how we treat each other that we examine and recommit to each year. We're highly collaborative. We seek input from others. I don't think I make any decisions without a whole lot of input from a whole lot of people. But we're also clear about, and we delineate roles so that we don't get confused all the time about whose decision is this, whose job is this. So within all of that, I would say it sounds really soft and sweet, but it's actually, as I said before, it's actually pretty fierce because we also hold each other to a high level of rigor and boldness, and we hold each other accountable. We push each other to open up spaces where public health has said this is not public health, to experiment, to try things that might fail, to push the envelope, so that we can really work towards our mission of transforming the field of public health to be bold. And then I'll say, because we work on relationships, I think we're also really adaptive. So we have had a lot of challenges, right? The field has been through it. We've been through the pandemic. We had the very, very public police murders of 2020 and the uprisings, the racial justice uprisings. And now we're looking at the precarity of democracy all around the world. And one instance of it is the way that people have pushed back against governmental public health. And so we've also had challenges of shifting to be a fully remote and nationally staffed organization during the pandemic, and learning how to stay connected while on Zoom with each other. And so we've really had to learn how to be efficient, delineate roles, like I said, and be highly collaborative. And so one other challenge is that as a progressive public health organization whose role and who sees itself as pushing the envelope, pushing the field to transform in entrenched ways of thinking that really are still trying to emerge from a biomedical model, I think that sometimes as an organization, we can be somewhat alone in our analysis. And we are really, we see our field changing, and we see our practice changing to come out of these old frameworks. But so, for example, we're really seeing the field of public health embrace its role in centering racism and undoing structural racism, and really centering equity and also trying to build power and understand power. But we're seeing a conceptual understanding and a difficulty in knowing how to operationalize that. So the challenge there is how to scale these experiments and new ways of practicing and move them into mainstream public health. The one good thing I want to say at the end of this question is that public health is the biggest growing major amongst undergraduates. It is now the biggest major amongst undergraduates. Because of the pandemic, more people know what public health is than ever before. So I'm going to take this as a good thing. And it's a really important crossroads that we're at right now, because we have the potential to really prove our relevance to communities, to prove what we do to partners. And part of how we can do that is by being better advocates, being parts of the movements that are actually winning the conditions for health, the housing, the incomes, the jobs, the community safety, and a healthy planet and democracy. Those movements are alive, and public health just needs to really become a part of them and join them and support.
Thank you so much for sharing. As you said it, very fierce work. Now this question is for both of you, and you already touched on it a bit. Could you provide some insights into collaborations and research projects with other sectors and organizations that have particularly benefited the communities? And what are some of the project outcomes you feel most proud of?
Yeah, I'll get us started. So in addition to some of the bridging work that Selma described, we support social justice campaigns and movements by conducting research that supports their campaigns, advocacy and organizing to elevate and use public health expertise and voice and framing. And as you've said, we focus on housing, economic and climate justice, and an abolitionist community safety. So we also support our government champions, our public health champions, with training, technical assistance, and leadership development to take action on health equity, to really build their capacity to operationalize all of this. And so within that, we have a number of success stories. If you go on our website, you can see a bunch of reports that we've done to support living wage workers and incarcerated people, people who are policed, people who are unstably housed, tenants, etc. And so I want to tell a few stories because it's always nice to end with stories, as Selma said. So we worked with a group called Starting Over in Riverside, California. They're a group of community organizers. We have been working them for a very long time, starting in 2018, when we first worked with them through our Power Building Partnerships for Health program that Selma described. And they were working with the Riverside County Public Health Department at that time in our year-long cohort program to learn how to build power inside and outside of government, how to build trust, how to break down harm, how to actually come to a shared understanding. And, you know, lots of years of support and work and technical assistance. And then they contacted us, the community organizers at Starting Over contacted us last September about their campaign to end that city's overtly racist, crime-free multi-housing policy. This policy encouraged landlords to discriminate against people with incarceration histories and to evict people that they even suspected of crimes, right? So you could imagine how that could work out. And so our staff have conducted independent research for the campaign, and we supported the organizers to develop their own research strategy to understand how to access public data and navigate local government departments. And so they did win that. They overturned that racist policy. It no longer exists in Riverside, California. And one of the things I want to point out about that story is that victory was many, many years in coming. I would say 5 to 7 years to create that victory. It didn't happen overnight, and it grew out of countless hours that this community organizing group Starting Over spent supporting people who are returning from incarceration, building communities, analysis, and power, and supporting movements. And we still have a lot of work to do. So public health has a big role. This was an important first step, but we really need to play a role in moving us towards a vision where people have recognized homes as a basic human right and not a commodity, and where we actually really replace the prison industrial complex with systems of care and support and health. So that's one story that I love. It just happened last year, so we're still very excited about it and really excited to see how it plays out. Another story that sort of illustrates what we do is during the we similarly during our Power Building Partnerships for Health program, we worked with the Santa Barbara Public Health Department and CAUSE, which is a local community organizing group. They also were in the same cohort, 2018 and 2019. There might be something in there about how long it takes for these wins to play out. So then the pandemic, you know, they were doing work together to build to have some small wins to protect farm workers, primarily hygiene in the fields, hand washing stations, etc. Then the pandemic came, and they found that they were seeing high rates of COVID amongst farm workers who were in H-2A housing, which is a kind of housing that's provided to farm workers with an H-2A visa. And so the health officer worked with the community organizing groups to write a health officer order. Right, so these health orders were using the authority of the public health department and she put out the first one of its kind in the country, which then spread to neighboring health departments to put COVID protections on this H-2A housing. And as you can imagine, there was a lot of pushback, and this community organizing group worked with this health officer and brought a whole lot of the community farm workers who were impacted to the meeting, the public meeting where this decision was going to be made, to show support and to show that they needed these policies to protect themselves. And so it passed, and they went on to provide a whole lot of other things: COVID services in Indigenous languages, and Indigenous farmer outreach workers, and supporting safer labor conditions overall in the fields. And so it really shows the precedent for how health departments can leverage their own administrative power to protect farm workers. And it shows how you can have various forms of power inside of a health department that you need to leverage, and in a community power building group that you can leverage, but they're most effective when you do it together. And all of that leveraging of power is built on long-term relationships. HIP had spent time working through past harm with them, working through experiences that the government had done that had actually traumatized and harmed the community. And so it took a long time for that win to come. And so we really feel like we're just at the beginning of this journey of really showing the world of public health that this is the kind of practice that should be central. And so we're trying to actually, this year, Selma's going to be working